Welcome to Easy Treatment Healthcare Private Limited, your bridge to global healthcare. At Easy Treatment, our mission is to be your preferred healthcare partner, providing personalized and comprehensive medical assistance to patients worldwide. Our vision is to be a global leader in medical tourism, known for our commitment to quality, compassion, and excellence in patient care. At Easy Treatment, we cater to all patients, ensuring a seamless healthcare journey regardless of your location or background. Start with a simple inquiry. Contact. Visit our website for an initial consultation, where we'll understand your medical needs, preferences, and budget. We conduct a thorough assessment of your condition, discuss available options, and assist in scheduling appointments with top-notch healthcare providers in Hyderabad. Our dedicated team will accompany you to hospital visits, ensuring smooth communication with healthcare professionals. We provide continuous support throughout your treatment, from follow-ups to medication assistance. Even after your treatment, we're with you every step of the way. From post-treatment care to coordination of follow-up appointments, we've got you covered. Our comprehensive services include medical tourism, free medical assistance, appointment scheduling, medication and investigation support, second opinion services, and budget-friendly hospital selection. Our exclusive services includes organ transplant, joint replacement, robotic surgeries, neurosurgeries, heart and cancer treatments. For our NRI patients with parents in India, we go the extra mile. We support in carrying them to the hospital and ensure their safe return home. We welcome your loved ones with open arms, offering arrival support, airport transfers, and initial orientation. Experience hassle-free healthcare with Easy Treatment Healthcare Private Limited. Your journey to wellness begins with us. Contact us today at.
Good morning. I'm Karishma. I'm welcoming you on behalf of Easy Treatment Healthcare. Today, we are hosting a gastroenterology webinar in the Easy Treatment AskTheDoc webinar series. I would again like to welcome everyone who is present today. Easy Treatment is a medical assistance organization dedicated to helping individuals with any health issues. We seek to provide a clear understanding of health problems, answer your questions, provide quick access to doctor support, and manage your treatment from beginning to conclusion and post-treatment. We extend a warm welcome to Dr. Adi Rakesh Kumar, and we feel honored to have him present this webinar. Dr. Adi Rakesh Kumar is a consultant, gastroenterologist, and therapeutic endoscopist at Yashoda Hospital with over 11 years of experience. After the presentation, there will be an opportunity for all of you to ask questions about the insights shared. So feel free to participate and make this webinar more interactive. So now I'm inviting Dr. Adi Rakesh Kumar to please continue.
Yeah, good morning. At the outset, probably I want to thank you for that kind introduction. Just to reiterate what she has been mentioning, I am Dr. Rakesh Kumar. I have been practicing gastroenterology for more than 10 years now. And my areas of specialties have always been the endoscopy related procedures. And of late, with the ever-increasing number of GERD and the reflux symptoms, we as a gastroenterologist are seeing more and more patients who are coming with these symptoms that are not getting properly relieved with the regular medication. So the unique initiative taken by the Easy Treatment was that, they wanted me to interact with you guys who are interested in knowing more about this disorder and how to get over this. So the plan, I believe, is that as per the Easy Treatment idea is that, we are going to have a brief introduction about the GERD per se from my end. And once we are done with that, then comes the interesting part. I will be more interested in trying to answer whatever queries you all have to know more about this particular disease entity. So should we start in? Yeah. So let me just briefly introduce you to what we call as GERD, or what we known as gastroesophageal reflux disease. So before we can start, let me tell you that why are we discussing this. Currently, GERD is one of the rising disorders of the gastrointestinal entity. I mean, thanks to a lot of urbanization and westernization of our diet, in my regular practice, I have started seeing more and more of these patients coming up. And this trend is more alarming in the most socially active group, that is, young people between the ages of 20 to 40. We are seeing this more. In fact, 10 years ago, GRD was always considered as a disease of the Westerners. But if you look at the Nature paper published in 2021, they have clearly mentioned that by 2030, probably India is going to become the epic center for GERD. And this is all because of the changing lifestyle. So much of urbanization and westernization of our diet, more refined diet intake, less physical activity. These are all the reasons why more and more of our patients are getting affected with this condition known as GERD. So what I'm going to just tell you briefly is that not much of technical jargon. I'm just going to keep it simple so that you understand what exactly happens when somebody suffers with GERD. And as you can see, the slide that I have put up, that's the basic human anatomy. That's the food pipe and the stomach. Between the food pipe and the stomach, there is something known as LES, or the lower esophageal sphincter. So the functionality of this sphincter is that whenever you eat food, it gets relaxed so that the food enters the stomach. And whenever there's digestion happening in the stomach, the sphincter is supposed to close tightly so that nothing in the stomach, that is the acid and the contents, they get reflux back into the food pipe. So that's how the normal body mechanism works. But in patients who have GERD, that is the area where the disturbance actually gets triggered off. For various reasons, the LES becomes dysfunctional. That is, it doesn't properly close after you have your meal, and that leads to reflux of the contents. And whenever these gastric contents, they start refluxing, that is the stomach acid and its contents, when it starts coming back into the food pipe or the esophagus and sometime into your mouth, this backlash actually is what that triggers off a chain of symptoms in these patients. Usually it starts sporadically. Patient starts having symptoms once in a while, but as they keep neglecting it, the symptoms starts becoming consistent, and repeatedly they keep occurring every day, and that's how GERD starts manifesting. So what are the common symptoms of GERD? The most common symptoms of GERD are heartburn. Most of the patients who come to our OPD, they come with a symptom of lot of heartburn, chest pain, reflux, mortar bash, too much of watering in the mouth. Sometimes the extreme GERD can cause reflux of the acid contents into the air pipe. Then they come back to us with chronic cough, asthma-like symptoms. And these are the most common symptoms why they come to us. And this is where we start treating them. But the most common myths that are associated are, people think that, there are certain fruits that trigger it. And sometimes they think that, smoking, which is probably one of the biggest trigger of GERD, but they all feel that, smoking affects lungs, but not the stomach, which is probably a myth, which we want to try to discuss a little more later on. And yes, children are no exceptional. We are seeing so much of GERD occurring in children. Well, drinking a lot of water not necessarily has a very positive impact on it. And finally, gastritis or H. pylori infection can cause dyspepsia, but GERD is never caused because of infection. So these are the common myths associated with GERD or the gastric pain. If you are more interested to know more about it, we can probably discuss about it. I was just mentioning facts, by 2030 and 35, India is probably going to become the captain of the world when it comes to GRD. So we need to watch out. And as I just mentioned, 20 to 40, that's the most active group that are commonly, we tend to see these patients coming with reflux symptoms. And as I was just mentioning, what triggers of this, I think, although I have mentioned quite a few, the first one should be the lifestyle. The lifestyle has a lot of bearing on the symptoms. No exercise, too much of erratic food intake, too much of refined diet, stress, strain. They are the ones that trigger the GERD more often. And of course, these are again, if the patient has concomitant hiatus hernia, patient is probably pregnant, they again trigger it off. And of course, obesity, which is the other burning disease that's epidemic that's coming up in India. This is also supposedly gives rise to a lot of GERD symptoms. And never to forget the smoking and the alcohol, which also contribute to GERD. Birth defects, they are more often less are the cause for GERD only in the children. We do not attribute birth defects as a cause for adult GERD, but we do sometimes see children coming up with GERD where laxity in the GE junction is probably the reason why they get it. So those are the common reasons why you get a GERD. And symptoms, well, I've already mentioned the symptoms. These are the usual reasons why the patients present to us seeking advice and medication. For these are the reasons why they come to us. And sometimes nocturnal GERD, this is also a reason. And as I mentioned, when you have a lot of reflux occurring, and if you try to neglect it, the reflux from the food pipe eventually starts entering the air pipe. And that reflux into the air pipe will start manifesting at not as gastric symptoms, but as a pulmonary symptoms. I do get a lot of referrals from my pulmonary colleagues where the patient keeps presenting with chronic cough or inflammation of the vocal cords, that is a reflux laryngitis, or in fact worsening of asthma or new onset of asthma. So these are the some of the extraesophageal manifestations of GERD that occurs when the disease goes beyond certain point. So these are also the manifestations of GERD. Do babies get it? As I already mentioned, a specific birth defects can give rise to reflux-like symptoms in the children or the infants. But the good point here is that if that particular defect or the birth defect is taken care of, the reflux usually subsides and they have a very good outcome. Yes, these are some of the symptoms in the children, which are little different from the adult. As I mentioned, excessive vomiting probably is one of the common symptoms why the babies come to us. Vomiting, asthma-like episode, and difficulty in sleeping are the reasons where we suspect that probably there is some abnormality in the G junction in the and how you take the food and what portion you are consuming definitely has a lot of bearing on the reflux symptoms. In fact, I would probably put food as the number one culprit if you ask me to say when it comes to the GERD disease per se. What do you do? Well, if we have any patient coming to me with these symptoms which I've just mentioned, and if the patient is uninvestigated, young guy, no comorbidities, usually I start the treatment first. I put them on good medication, ask them to change their lifestyle, focus more on it, and then they come back after maybe 6 to 8 weeks. I do not do any investigations for a patient who is coming up with the first time symptoms. And 75% of our patients, they respond very well to one single drug, that is proton pump inhibitor or your pantoprazole and rabeprazole. If the patient is coming with very short history, a good 8 weeks of proton pump inhibitor along with considerable lifestyle changes, 75% of them will get rid of their problem within 8 weeks. This is not me saying it. This is what the American College of Gastroenterology, they have published in their guidelines. 75% is the chance of treatment success if patient just takes that pill and has good lifestyle changes. And patients probably who do not get any remission of symptom for various reasons, when they come back beyond 8 weeks with still suffering with GERD-like symptoms, that's when we start investigating them. Our investigation usually consists of endoscopy. Esophagogram is something that we used to do before, not anymore now. It's more of endoscopy now, followed by the new tests that we have got that are really helping us in understanding the GERD symptoms more, is the esophageal pH testing. That is, this is one unique test where you actually quantify what's the amount of acid that is actually refluxing from your stomach into the food pipe. Thereby, we can give a roadmap to our patients ki how is the best way you will get relief from your symptoms. Is it drug alone? Is it some endoscopic procedure, or is it some surgical procedure that will make you better from your symptoms? So this new test that is called as 24-hour esophageal pH testing along with manometry is really helping us now in understanding the pathophysiology and the reason of the GERD in each patient so that we can offer a better treatment to them. Well, when it comes to treatment, as I already mentioned, your favorite pantoprazole and omeprazole, these are the usual drugs that I always start. The H2 blockers, that is the ranitidine or the Rantac, is something that I don't write much. And PPIs, as I already mentioned, 75% of a patient, if they are very compliant with the drug, within 8 weeks, they get a very good relief of their symptoms. And patients who do not get symptom relief even after 12 weeks of aggressive medical management along with significant lifestyle changes, if there is no relief occurring to their symptoms, that's where we evaluate the patient first with a good endoscopy, a 24-hour pH monitoring, and a high resolution manometry, and then decide what is the trigger for the patient's persistent GERD symptoms. If we find that probably the patient has got a big hiatus hernia, and that hiatus hernia is leading to a lot of reflux of the symptoms, and if that is the reason, then usually surgery was the norm. Surgery in the form of fundoplication, that is strengthening the G junction, was what we used to offer a lot to our patients. But unfortunately, the number of patients of reflux disease who are willing to go for surgery as per the literature is less than 5%. And nearly 30% of the patients are not getting good relief with the PPIs, and they are not willing to go for surgical intervention. So these 30% of patients are stuck in the middle. They are not getting relieved of their symptom with PPI, and yet they don't want to go for surgery. So these are the patients in whom we are trying to give something called as minimally invasive procedure. Now, this is the emerging treatment modality that is trying to alleviate the symptoms by strengthening the G junction using one of the 3 procedures that I have mentioned in the slide: ARMA, GERDEX, or TIF. These 3 are the endoscopic modalities. That is, you are not going to do any sort of surgery. In a selected patients of persistent refractory GERD, endoscopically, you can strengthen the LES, that is the lower esophageal sphincter, either by using ARMA, GERDEX, or TIF. And literature has shown that in a selected patients, this endoscopic treatment can really give you a lot of relief, and these patients can be off their drugs for treating the GERD. And well, if I find that my patient has got a large hiatus hernia, and that is the reason why he's having GERD, then I might just straight away send him to a surgical fundoplication. Again, fundoplication is nothing but all we are trying to do is, if you remember my first slide, LES, lower esophageal sphincter. The lower esophageal sphincter is lax, hence you have a lot of GERD symptoms. Whether it is endoscopic or surgical, all we are trying to do is we are trying to strengthen it so that the reflux symptoms come down. So Nissan's fundoplication is nothing but strengthening the LES so that your reflux symptoms go down. So these are certain the tricks that you can always use it when you are having a lot of reflux symptoms at your home. These are the home remedies. Helps you most of the time. But if you're struggling, I would definitely advise you to take a professional help so that you can alleviate your symptoms very quickly. So I think I'm done with the presentation. So back to you guys.
Hello. So now anyone wants to ask any questions, you can just ask. Doctor will answer your all the questions. And if you have any language barrier also, you can ask any language. We'll try to address your question.
Hello, sir. Good morning, sir.
Yes, hello, good morning.
Speak in Tamil, sir, or English?
Not an expert, but I'm sure there are people to help me. Please go ahead. At least Hindi or English might be better.
Okay. Talk in English, sir. I have gastritis problem for past 2 years, sir. I have done endoscopy 3 times, sir, but it
Okay.
not cure. But it not cure, sir. I have taken medicines regularly.
Okay.
It not cure regularly, sir. I have
So I
endoscopy.
think yes, please complete.
My endoscopy report was pancreatitis, mucosal propolis, laxless,
Okay. Okay.
but it not cure, sir. I have go all the hospitals, sir. My age was
Okay.
20. Sir.
Okay, that's a very young age. Okay, fine. See, I mean, if I can understand your problem correctly, you have been having these acidity symptoms going on for more than 2 years. You underwent multiple endoscopies, and no matter what drugs you are taking, you are not getting good relief. I
Yes,
hope
sir.
I understand that way. Yes. So what I can probably advise you is that one, if you have already taken good number of medications, and if you have already corrected your lifestyle significantly, and still if you feel that you are struggling with your symptoms, it's not getting alleviated, then I think probably we need to look at your reports in detail. I think probably if you want me to have a look at, if you can channelize through these people, this platform, maybe I'll just have a good proper look at your investigations, and then probably I might be able to answer your query in a better way.
Okay, sir.
Yeah, thank you.
So can I show my report, sir?
You can probably send it to them. I think probably we can see it later on once we are done with the interaction. I will go through this and I'll try to reply privately to you. Okay.
Okay, sir. Sir,
Please.
I have
Yeah.
one more doubt, sir.
Yes.
Sir, can ulcer turns into cancer? Many people said that in Europe, ulcer can turns into cancer. What about
Well,
your?
well, see, here I'll tell you, it depends on where is your ulcer. If the ulcer is in the duodenum, that is the first part of the small intestine, these ulcers are always benign. That is, they cannot become cancer. If the ulcer is in the upper part of the stomach, and if it is neglected for long, if it becomes too big, yes, there is a very remote, very less than probably 0.1% that this will become a malignancy or cancer. But the incidence is very less.
Okay, so how long it takes, sir? How long period it takes into cancer?
Probably a couple of decades, if I'm not wrong. It might take 20 to 30 years for the transformation to occur. Let me tell you this way. See, this was something that was thing of past 30 years, 40 years ago, when we did not have a proper drugs. This was something that was observed. But now we have so many drugs available to treat the dyspepsia and the ulcer. We no longer see ulcer transforming into malignancy. At least in the last 10 years, I haven't seen one happening, because there are so many drugs available, and all of these drugs are OTC drugs that are available over the counter. So even the patients are smart enough now. They have acidity symptoms, they just go to the pharmacy, procure the drug and take it. So now this longer to, if I put it properly.
Okay, sir.
I hope I answered you.
I was fear only.
Yeah, thank you.
Thank you, sir. Sir, can I take ulcer
Good morning,
tablets
sir.
daily or?
Good morning, sir.
Morning. Yes, please go
Sir,
ahead, please.
I have suffering from. Sir, I have suffering from past 6 months. Good in a good. I have consulted so many doctors, but I treatment. matlab, I have intake so much medicines in like esomeprazole, pantoprazole,
Yes, go
GERD,
ahead. What
sir.
are you trouble with?
Laxless.
You are
I have
having GERD for the last 6.
my endoscopy was done in the month of October. The impression is laxless.
Mm-hmm.
Impression is laxless. And
So,
that's in the form of
so
GERD.
Mr. Yeah.
I have intake. I intake. I already intaken in so much medicines
So,
like
Mr. Rehan,
हाँ सर जी सर जी
Mhm. Mhm.
हेलो
You are having classical GERD because of Mr. Rihan. I hope I am audible to you.
I have sir much medicine
Hello.
esomeprazole pantoprazole omeprazole all medicines I taken.
So you have already you are having suffered from the symptom for more than 6 months. You have already got an endoscopy which is showing that your sphincter is not tight, and already tried quite a few drugs and there is no relief to your symptoms. Then I suggest
Yes.
that you get a 24-hour pH to quantify the acid and then probably decide
That is
what is
negative.
to be done, whether we
H.
should
pylori
offer
was
some
negative.
endoscopic.
H. pylori was negative.
H. pylori has nothing to I understand, but H. pylori has nothing to do with GERD. GERD in your case
Yes.
is because of the laxity of your LES.
Yes, sir.
Okay. Yeah. So
Yes.
better approach your gastroenterologist near to you, get a 24-hour pH, and if there is a defect in that, probably you have to go for some endoscopic or surgical fundoplication that will make your symptoms go away. Okay.
Is a fundoplication is done with laparoscopy or any endoscopic using endoscopy?
You can do it endoscopically, you can do it surgically, that is laparoscopically. Both the procedures
अच्छा
can be
अच्छा
done, but the procedure is dependent on the 24-hour manometry report of yours.
अच्छा. Is it the fundoscopy is it successful surgery or not?
See, Mr. Rihan, the success story depends on many factors, and the one of the major factor is that how much is the burden of your problem.
Is it successful? Is it successful? Once I have done my fundaflocation, but it can't revive. It can't. Symptoms will not back to after the surgery was done.
So that's what I'm
मतलब
saying. See,
मतलब
you have to
symptoms
understand one thing.
मतलब सिम्टम्स तो वापस तो नहीं आएंगे ना फिनाफ्लोकेशन करके. मैं जब फिनाफ्लोकेशन डन करूंगा ना तो उसके बाद
Rehan
वो फिर
ji,
से मत होगा रिपीट.
Rehan ji, that is what I'm telling you. सर्जरी करने से पेशेंट जाके फिर अगले महीने से दारू
यस
पिएगा, सिगरेट करेगा, अपना वेट पे काबू नहीं रखेगा, तो जीआरडी 2 साल क्या है, 6 महीने में फिर आएगा. So the symptoms are again always on the patient's lookout. Surgery is not the answer to your problem.
I have
Surgery
already
will
done
only.
I have already done I have already done my precautionary measures. Tea and spicy was my tea and spicy मतलब things was avoided, totally avoided.
That's good. You're
I cannot
trying.
intake
All I can tell you,
I
yes,
I
that's
cannot intake spicy things such tea and other spicy things. I cannot intake any.
yeah, that's good that you're trying from your end. So all I can suggest is that probably you go and meet your nearest gastroenterologist, express him your desire to get 24-hour pH and manometry done. Maybe that should help you in deciding what is the next action for
Sir,
you.
I
Okay.
have much gastroenterologists consulted much gastroenterologists, but they only मतलब prescription for medicine to esomeprazole etc. वगैरह amitriptyline etc.
Maybe you approach a little bit a place where the gastroenterologist does a 24-hour pH and manometry. I think that should be helping you out.
Sir, I have one doubt.
Good morning, sir. Good
Morning.
morning, sir. My name is
Morning.
Nelson, and I'm 28 years old. For the last 1 year, I have been suffering from acid reflux. And
Mhm.
something stuck on my. I feel like something stuck on my throat, and there was no
Mhm.
any other like no heartburn or any burning sensation. I didn't feel. And then like after 7 months of symptom, I went to the gastroenterologist, and they went to endoscopy. At endoscopy, there
Mhm.
was we found out that gastritis was there, and H. pylori infection was also there. So they put me on
Okay.
14 days therapy, antibiotic therapy, And then I again, after 14 days of therapy, I again took the endoscopy again, and uh, H. pylori was negative at that time. And then they took the biopsy also, and then in the biopsy, the result was chronic malinflammation, no sign of malignancy or any other like cancer things. And then I went to Max Hospital, and they suggested me to do 24-hour pH study and endoscopy also. And in the endoscopy, I found out there's hiatus hernia, grade 2. And in the 24-hour pH study, my acid reflux was around like 14%. 4% was normally for normal human beings, and mine was 14%. They said it's quite a reflux. So they put me on PPIs for 8 weeks, and I'm under treatment of PPIs. And sir, may I know is your chance of success on this treatment? Like that's it, sir. And I only feel only sensation, lump sensation, lower sensation. That is the only thing right now.
Well, Mr. Nelson, I think you have very, very broadly explained your symptoms. Unfortunately, you are having a lot of troubling symptoms, and you have done the right thing. You have approached the right doctors. They have been working you in a right manner. I mean, they got the 24-hour pH and the endoscopy done. So, based on the information that you have given to me, I can tell you that probably you got a refractory GERD, that is gastroesophageal reflux disease, that is not responding to conventional drugs. So here is a situation. If you feel that the symptoms are really disturbing your lifestyle and your daily activities are getting significantly hampered, I would suggest that probably with all your current reports, you should approach your nearest gastroenterologist or a surgeon and probably decide for a very good reflux procedure, anti-reflux procedure, whether it is endoscopic or surgical. I think that will be decided by your treating physician based upon your reports. But this much I can tell you that your symptoms are persistent, they are refractory to your drug, and you already got an endoscopy and 24 pH, which is showing significant reflux activity. So I might suggest that reach out to your nearest gastroenterologist or a surgical gastroenterologist, and then probably plan one of the anti-reflux procedures to make yourself better. Thank you.
Okay, thank you, sir. Like, I would like to know which are the anti-reflux procedure. Fundoplication, I know. Then is there any other procedure also?
If you look at the last 15 minutes back, the presentation I tried to give to you guys, surgical fundoplication has been there for more than 20 years. It's been there for more than 20 years, and it's one of the effective procedures you have. But now, currently, we also have a lot of endoscopic coming up procedures.
Okay. Thank you, sir. Thank you.
Hi, sir. My name
Hi,
is
sir.
Revati. Last year only I got gastric related problems, and doctor. Hello, sir. Am I audible?
No hiatus hernia. Then there are.
Hello. Hi, sir. Am I audible?
Yes, I'm able to follow you.
Yes, sir. Yes.
Yes.
So I was diagnosed with gastric problem, and my doctor suggested me to take Ribcan plus tablet daily on empty stomach. So I'm taking that medicine, and recently uh, my prolactin level was went high, and due to that my periods were irregular. So I consulted an endocrinologist, and he asked me that the first thing is that whether you are taking any medicines related to gastric problems. I said yes, I was taking this Rabcan medicine from the last 1 year. He asked me to stop that immediately, and instead of that he suggested me to take pan 40. So, is there any relation that if I take Rabcan plus that will affect my prolactin or other hormone levels in my body?
Absolutely. You brought a very valid point. This is the one danger that we face in Indian scenario, because our patients, they have this tendency of going for OTC drugs, over the counter. See, the moment a physician, they try to continue the drug, hoping that that is giving him the relief, so they continue it. In your case also, you have been taking Rabicaine Plus for more than a year. Now, Rabicaine Plus contains levosulfuride, which is a documented drug to increase your prolactin level significantly, and that was the reason why you had those gynec disturbances coming up. Luckily for you, these are all reversible after cessation of the said drug. But what message I can give to you guys is this. That is the reason why we keep interacting with people, saying that these entities, the GERD, acidity, dyspepsia, all of them, they have cure in the form of drugs. But these drugs, after a certain point, if they are not giving relief, you have to get evaluated why you are not getting relief, and then change your plan accordingly. You cannot continuously take or just continue to take one drug, which after some time will start manifesting the side effects which just happened in your case.
Sir, one more thing, like after taking that pan 40 tablet, I'm taking it from last 2 weeks. I'm still facing, some or
Mhm.
the other day, in these 2 weeks, I felt like at least in 4 days, I'm feeling this heartburn, stomach burning issues. But I don't know whether the tablet is working for me or not for my gastritis problem. What should I do?
No, definitely you had this. See, as I mentioned, we try to give drugs for 8 to 12 weeks. And as I
Okay.
mentioned, 75% of the patient do have relief. But the 25% of patients who do not have relief after 3 months, we investigate. We do not ask the patient to continue their medication indefinitely. Investigate, get a proper endoscopy, document the sphincter status, and if there is some laxity or if there is some issue there, then probably you have to upscale to the next investigation modality, that is 24-hour pH or a manometry, and then accordingly plan the next line of action. As you mentioned, your history is more than 1 year, so I am sure you
Yes.
should have got an endoscopy by this time.
Okay, so stopping this Rapkind will decrease my prolactin levels, right? Although I'm taking
Absolutely.
medicine for that.
No,
Okay.
no, prolactin will go down once you take off the drug.
Okay. Sure, doctor. Thanks a lot.
Yeah, thank you.
Hello, sir.
Right.
Good
Oh,
morning.
can I take?
This is Shreya from Hyderabad. So,
Yes,
actually,
please go.
I have issues constantly from 10 or 12 years, like when I was a little kid. So, from that time, the gastritis started, and I started taking Pan 40, and right now it is those rabiprazole and all. With GERD, before 6 months, I was, diagnosed with a little ulcer that was superficial because I got a little, blood clot in my vomit. So before that, I used to have, a heartburn, and I have this anxiety disorder because of this gastritis and post nasal drip and all those symptoms which you can think
Okay.
of. So currently, what's happening is my stomach gets heavily bloated, and whenever I eat, and if I don't eat, I'm fine, and if I eat after that, the symptoms get worse. Sometimes antacids help, sometimes those carom seeds or fennel seeds help, but mostly I've noticed if I'm changing my lifestyle, like if I wake up early in the morning, have food at the proper time, and no dinner after, like 7 or 8 p.m., then everything is, a little stabilized. So I am taking the gastritis medicine daily in the morning, thinking that it will reduce the symptoms, but most of the times the drugs don't seem to work. So I am now confused that whether I should, monitor myself following the same lifestyle for some time, or because I'm having these symptoms, yeah, like, night I'll be sleeping and I'll just wake up choked with all those
Mhm.
gas and all. So what should I be doing? Because endoscopy did not reveal anything, and doctors, they suggest that you just change your lifestyle, things will be fine. suggest the medicines for few weeks or months, and then ask me to change the lifestyle. After the medications, I'm fine. After leaving it, the symptoms are back then.
Yeah, yeah, I can relate with you. I can understand that this is the common scenario we come across in our practice a lot. It's unfortunate
Mm-hmm.
that our patients, they tend to suffer these patients. So
Mm-hmm.
the acidity disorders, they are never mortal. I mean, they do not lead to any significant major hampering in your overall lifespan or anything like that.
Mm-hmm.
But the morbidity, the disturbance that these disorder cause in your day-to-day activities is so huge that you end up developing certain anxiety disorders. They tend to
Yes,
have a low mood, depression. So these disorders, by causing these low mood, anxiety and stress, they actually have a lot of bearing on your day-to-day life. So I think that becomes a
definitely.
burden, in fact. So unfortunate for you, you tried all the tricks, but you are not getting a good relief. What I might suggest is that if you have already by this time doing a lot of lifestyle changes, and your
Mm-hmm.
drugs, which you are already using them, but if you feel that the symptoms are really not coming down, you're really struggling, yes, if the heartburn and reflux is quite high in spite of the drugs, I would definitely recommend in your scenario to get a 24-hour pH and a manometry. These are the two modalities that have really been a game changer for us in the couple of years, because we can triage the patient, quantify their acidity levels, and then put them in different categories, whereby we can tell you, give you a roadmap well by saying
Hello, sir, your voice is breaking. I'm not able to
that
hear you.
you have a reflux that responds only to. What I was trying to tell you is that, sorry for that technical glitch. What I was trying to tell you is that
Mm-hmm.
you do have a symptoms that require next level of investigation in the form of either a manometry or a 24-hour pH, and then triage yourself what exactly is the intensity of your problem. If it is can be treated with drugs, or should we do some anti-reflux procedure. So I think you need to
Yes.
seek out a professional help, and then a gastroenterologist might be able to solve your problem.
Sure,
I
sir,
hope that
because
works
the
for you.
heartburn and acid reflux that has reduced significantly, but the only issue that currently I'm having is, the bloating and the full feeling chest tightness and the feeling like, anxiety disorder, death and everything.
I get it.
So that's what is concerning right now.
Yeah, I think I understand the morbidity of your problem, but I would definitely say that reach out to your gastroenterologist, maybe request him whether he
Mhm.
can put forward the other tests so that you can get a better understanding of your condition. Thank you.
Oh, okay, sir. Thank you so much.
Hi, sir. Good morning, sir. Hello.
Yeah, thank you. Thank Yes.
Hi, sir. Sir,
Yes, please. I am very much in online. You are audible to me. Please go ahead.
okay, sir. Sir, actually, I'm facing this problem from last 2 years, sir. And it started only after the COVID. I got COVID asymptomatic. Is that anxiety cause gastric problem, sir? Yeah, because
Mm-hmm.
after COVID, yeah, my
Coming.
dad, my mom, all were
Uh-huh.
admitted, sir. Due to the panic, after getting
Uh-huh.
released from the COVID, also, I had this fear. Might I will get again? I will get again COVID. I will spread to my mom, my dad.
Okay.
This issue caused me to gastric problems, sir. But I took endoscopy as well. I took drugs, everything. They said it's in normal stage. You can cure. But still, I'm having issue in. It's passing through my legs, sir. Like hand, uh, whatever when I eat food daily, I'm facing this gastric acid. But now anxiety is
So,
normal, sir. I took brain mapping as well, sir. The doctor said me that yes, you have some chemical forms in your brain. Now it is normal, but I am not getting rid from this gastric, sir.
So unfortunately, see, it's as I mentioned, it is always multifactorial. most of these chronic disorders, whether it is acidity, dyspepsia, GERD, there is no one reason and there is no one solution to the problem. It's always multifactorial. The reasons for acidity are many, and the need of the treatment modalities are also quite variable with their own success rate. So it always the combination that works. In your case, probably the stress triggered of the symptoms. The stress persisted for some time. You got rid of the stress, but some of the GI symptoms are still persisting. So
Yes, sir.
if your doctor feels that your anxiety and stress is totally under control, then I think that if the drugs you're giving are good enough, I think you should get a relief. But if you feel that the drugs are not giving you good relief, as I mentioned, investigate further. I'm sure you'll find a reason why you're having the symptoms, and then we can plan the treatment accordingly.
Okay, sir. Okay, sir. Yes, sir. Thank you.
Yeah. Yes, please.
Sir, can
So,
ulcer patient take tablets regularly or weekly, twice or thrice, sir?
what is that?
Sir, ulcer patient take daily tablets or weekly, thrice or twice, sir?
So please do not self-medicate. Do not self-medicate. The duration, the timing, everything will be decided by your treating doctor. So all I suggest is that please check out with your treating doctor. He will give you the plan of action.
Okay, sir.
Self-medication, I think we discussed with Revati there. She had a trouble because she was using the drug for too long. So do not self-medicate. Check with your liaise with your local treating doctor, and then you will get a better outcomes.
Okay. How many times a person do endoscopy in a year, sir?
No, endoscopy again. If you have not read my message, endoscopy is a one investigative modality, the necessity of which is totally decided by the treating doctor. If symptoms are not there, there's no need to get repeated. If you have some persistent symptoms, then yes, they might plan it.
Yes, a lot of times do endoscopy. Lot of endoscopy done, any side effects, sir?
No side effects.
सर नमस्कार।
Namaste.
सर श्याम बोल रहा हूँ मैं। 57 ईयर
Yeah.
एज है। हिंदी में बात करूंगा मैं आपसे। जी सर।
बोलिए।
30 सालों से मुझे प्रॉब्लम है। डॉक्टर्स गैस्ट्रोएंटरोलॉजिस्ट मुझे आईबीएस डिक्लेयर करते हैं। पीपीआई प्लस लेक्ची फाइबर प्लस कभी नेप्रोक्सोन इस तरह की मेडिसिन देकर मेरा समय निकलता है। उनको बीच बीच में चेंज करते रहते हैं। जैसे 15 दिन मैंने लिया, 15 दिन ठीक रहा, फिर कुछ अदर दे दिया। ऐसे 15 दिन तक ठीक रहता हूँ, फिर सिम्टम्स ये के अगर होते हैं। और विशेषकर सर्दियों में कुछ वेट लॉस हो जाता है मेरा। जी सर। गैसेज फॉर्मेशन, डकार बहुत ज्यादा आते हैं मुझे, बहुत ज्यादा भयंकर। जैसे यहाँ
आई थिंक आपका जो आपने बताया है क्या है, अभी श्याम जी जो ने आपने सिम्टम्स बताए, ऑब्वियसली आपके सिम्टम 30 साल से है, सो दिस लॉन्ग ड्यूरेशन। वेल मोस्ट ऑफ द टाइम दीज आर फंक्शनल डिसऑर्डर्स बोलते हैं हम इनको, जैसा आपने मेंशन किया आईबीएस। सो इट्स अ ब्रेन गट इंटरेक्शन इज वेरी कॉम्प्लेक्स। कैसे आपका ब्रेन आपकी इंटेस्टाइन से बिहेव करता है। Sometimes I feel the relation between the brain and the gut is like that of a wife and an husband. So sometimes they get along well, sometimes they don't get along well. So when they don't get along well, that's when the trouble starts. So
सर यहाँ पे सर साथ एक प्रॉब्लम और भी है सर। अगर मैं मेट्रोजिल, टेंडराजोल, ऑफ्लॉक्सटिजेड, सिप्लॉक्सटिजेड इनको मैं 2 दिन भी ले लूं तो मेरी गैस फॉर्मेशन और अदर सिम्टम्स जो हैं वो 70-80% तक कम हो जाते हैं। उस समय मुझे पीपीआई की
बताइए।
जी सर। उस समय मुझे किसी पीपीआई या एंटासिड या एंटी गैस फॉर्मेशन की कुछ जरूरत ही नहीं पड़ती मुझे। जी सर।
सो मैं इतना ही बोल सकता हूँ श्याम जी कि आपका सिम्टम्स अनफॉर्चुनेटली बहुत लंबे समय से है, This is what we call as functional dyspepsia and IBS bolte hai isko. These are chronic persisting problems. They do not have one answer, simple answer. And many drugs work, many don't work. All I can tell you is that, I can sympathize with you. All I can tell you is that be in touch with your doctor. I'm sure they'll find a better way to treat you and make you comfortable. So, well,
Hello.
I think we had, yeah. Yes, please.
Sir, namaste, sir.
Namaste.
Sir, recently and sir, Telugu में बात करूँ sir, थोड़ा.
చెప్పండి.
సార్ రీసెంట్లీ నాకు బీపీ వచ్చింది సార్ 3 months బ్యాక్. ఆ తర్వాత కొంచెం టాబ్లెట్లను వెనక ముందు వేసుకోవడం వల్ల యాసిడ్ రిఫ్లెక్షన్స్ వస్తే గ్యాస్ట్రాలజీని కలిసింది సార్. ఎండోస్కోపీ తీసిండు. ఎండోస్కోప్ తీయడం వల్ల ఆహార వాహిక కొంచెం లూజ్ అయిందని చెప్పింది సార్. అందుకోసమే మన యాసిడ్ రిఫ్లెక్షన్స్ వస్తున్నాయని చెప్పింది సార్. టాబ్లెట్స్ ఏమి ఇవ్వలేదు. కాకపోతే చెస్ట్, ఇది మెడ నొప్పి, ఎడమ చెయ్యి ఇవన్నీ నొప్పులు వస్తున్నాయి సార్ మొత్తం.
సో అదేనండి, ఇందాక మనం డిస్కస్ చేసింది అదేనమాట. సో ఈ మధ్య కాలంలో ఇది బాగా పెరిగిపోతున్నది ఇన్సిడెన్స్. ఈ ప్రకారంగా సిమ్టమ్స్ రావడం అనేది పేషెంట్ మన అన్నవాహికలో మన అన్నవాహికకి కడుపుకి మధ్యలో ఉన్న ఆ కండ లూజ్ అయిపోవడంతో కడుపులో ఉన్న ఆహారం ఉన్న యాసిడ్ అంతా ఛాతిలోకి రావడంతో పేషెంట్లకు ఛాతిలో నొప్పి, మంట, వాంతులు, దగ్గు రావడం జరుగుతుంటది. సో మీ డాక్టర్ గారు ఎండోస్కోపీ ఆల్రెడీ చేశారు. దాంట్లో ఆయన లాక్స్ ఎలియస్ అని రాసేశాడు. సో కొంచెం లైఫ్ స్టైల్ కరెక్షన్ చేయండి, కొంచెం మెడికేషన్ వాడండి. దాంతో తగ్గిపోతే వెరీ గుడ్. ఒకవేళ అది వాడినా తగ్గలేదు అనుకోండి, మేబీ నేను ఇందాక చూపించినట్టు ఈ టెస్ట్లు ఉన్నాయి, ఇప్పుడు కొత్త టెస్ట్లు, వాటిల్లో ఈ లాక్సిటీ ఎందుకు వచ్చింది, ఇంకా ఏమైనా చేస్తే దాన్ని గట్టిపరచవచ్చా అనేది మనం నిర్ధారిస్తే దాగరంగా ఎండోస్కోపిక్ కానీ సర్జికల్ ప్రొసీజర్ చేస్తే చాలా మటుకు సిమ్టమ్స్. సో ప్రస్తుతానికి మీ వాడే మందులు వాడండి ఒక 3 నెలలు. ఆ తర్వాత కూడా ఇబ్బంది తగ్గలేదు అంటే మీ దగ్గర ఉన్న గ్యాస్ట్రెంట్రాలజిస్ట్ లేదా మా దగ్గరికి వస్తే ఆ 24-hour pH చేసి చూసి ఇంకేమో చేయవచ్చా మనం డిసైడ్ చేయవచ్చు.
థ్యాంక్ యూ సార్. ఈ గుండెల పెయిన్ వస్తుంది.
అదేనండి, ఇది కూడా దాని వల్లనే వస్తుంది. ఐ థింక్ మనము ఫస్ట్ ఇది మందులు వాడండి, తగ్గనప్పుడు మనము చేసి చూద్దాం. ఓకే,
థ్యాంక్ యూ సార్.
నమస్కారం సార్. హలో, నమస్కారం.
హలో.
So I think we have too many people who have too many queries, but I think we are running short of time also. So all I can request is the people who have organized this platform, my request to them and all the people who have come online to discuss, please send your queries and problems in the chat box. I might be able to answer them and I'll try to get back to you. I think probably that's the best way we can do. I think the anchor who is organizing this platform, if I can get in touch with you, what we'll do is that we'll request all queries in the chat box and we'll try to get back to them. Is that good?
Yes, sir.
I think that sounds good to me. So I think with that, we should probably thank you guys from the Easy Treatment. You have been very helpful in trying to put a bridge between the patients and myself. I hope I try to answer most of the queries, but people who have a lot more queries coming up, ask them to put it in the chat box. We'll try to get back to them. Okay. So once again, I thank all the team backing up the Easy Treatment. Thank you for the coordinating and putting up this stuff. Thank you.
Thank you, doctor. Thank you so much. Thank you, doctor. Thank you so much for your valuable time you have given for our clients and all. So today, actually, there is a very lack of time to address all the questions. And please, what are the members who are still pending? If they have some question they want to address, they can contact us on WhatsApp. So we can just try to solve your problem. We try to, if you have any reports and all to give to you want to send to the doctor, if you want to book an appointment and all, you can also, everything you can just contact us through the WhatsApp. We will definitely take it the personal. Okay, so thank you all the participants.
Hello.
Thank you all the participants who attend our webinar on gastroenterology. If you require any further assistance, treatment, healthcare suggestions regarding gastroenterology or any other health issue, so please do not hesitate to contact us. You have the number. I am repeating again. The number is 900-000-1766. Our dedicated team is here to provide you with the proper support and guidance, whatever you need. Once again, thank you for joining us today. We look forward to serving you and continue our journey towards better health. Thank you.